This is Heart Rhythm TV, and I'm Janet Han here with my lovely co-host, Mehak Dhande. How are you?
Feeling great. It's really interesting to be on this side of the
I know, I was
microphone.
gonna say, now you're on the hot seat at HRX 2024, so I get to interview you, which in our years together, we have not yet done this. So maybe at some point you'll do me. But I wanted to talk to you today because you are doing something super exciting and super innovative, which is like, this is the perfect conference to talk about that. And it is some kind of QI project, right, with HRS. So you want to dive in a little bit about that?
Absolutely. It's such an honor to be here with you, first of all, to be interviewed by your role model. It's a good day.
Nice.
Yes, so this is a QI project that we're very, very excited about. We've secured sponsorship funding from BMS Pfizer Alliance for the Quality Improvement Committee. And the purpose of this project is to harness the power of generative AI in a responsible, patient-centric, and guideline concordant manner to impart education about atrial fibrillation. And we're going to be working with our technical partners at Lucia Health Guidelines and very closely working with the Patient Caregiver Committee and with the QI Committee here at HRS. So the funding is for HRS to delve into this QI project. And my role is as the PI for the phase 1 study, where we're really going to be studying the challenges and opportunities that this kind of technology presents when we're trying to really impart responsible education to our
absolutely.
patients.
I feel like this is going to be a great project, but with everything that has to do with AI now, even though we're super enamored, I'm sure that there might be some challenges, right? So what are some challenges that you might foresee?
Yeah, absolutely. I think one of the most important things here is to understand the opportunity and understand the gravity of the responsibility. With the scope of generative AI being huge, and HRX Innovation Hub is the perfect place to talk about this, right? Whether it's operations or system optimization, care pathways, platform thinking, access to care, decreasing healthcare disparities, we think of generative AI as having so much promise, but sometimes we realize that the outcome's the exact opposite. We may be increasing bias, we may be increasing care gaps. And so a couple of unique things about this project are that we want to include patient representation, patient voice very early on in the pre-deployment phase. And we're working with 2 very well-regarded patient advocacy groups in order to do that. And we also want to make sure we're abiding by all the principles of AI governance. Of course, it's a very rapidly changing landscape, but when it comes to safety, when it comes to transparency, explainability of these algorithms, how generalizable they are, what the clinical validity is, and how do we use, let's say, vetted resources, RAG pipelines to make sure that we apply the appropriate guardrails and we're transparent with our patients about the residual risk at the end of the day. All of those things are unique aspects of this endeavor. And so the flip side is what makes it unique and exciting also is the challenge. And so we're hoping to have a robust steering committee, and we're really glad to have Dr. Dave McManus agree to chair that committee. We're assembling the rest of the committee right now. We're very grateful for the support from Dr. Ellen Bogan, president of HRS, from Pat Blake, the CEO, and the team, the QI team, patient caregiver committee team, the practice improvement department really has been so supportive, and we are all really wanting to do this responsibly and well, so yeah, that's essentially the challenge and the excitement.
Right, and I feel like it really kind of speaks to HRS's investment in sort of innovation and moving forward, right, and looking forward a little bit. So I'm really proud of that, to be honest. Where do you think this study sort of lands in the landscape of sort of generative AI in general?
I think the role of this study will be more so in understanding what do our end users, in this case patients, what do they need, and how best we can cater to those needs. I like to think about the generative AI landscape, and especially when it comes to patient-facing applications. We could either see it as a loudspeaker of bias, which we've seen, right? Dr. Obermeyer, Michelle Mello, during their Senate Finance Committee hearing, they talked about how some of these biases can really be magnified by generative AI. So we could either be limited by that, or we could use this as an opportunity for having a microphone into which our feedback and our elaborate prompts guide the further growth of these algorithms. So that's really the direction in which we're hoping the study goes, that we use this intensive, intentional study of the scope of these algorithms to be a microphone to mitigate bias instead of expanding it.
Sure.
And then being very realistic about the residual risks and being realistic about what it does and what it does not do. And 10 years ago, saying, oh, machine learning is going to solve all of healthcare's problems was definitely premature. I think 5 years ago, for clinicians, for innovators to say, get involved in these ventures was a way to maybe shape the future of medicine, and the promise really began. And at this point, I think of it almost as a categorical imperative that we ought to partake.
Of course.
Or at least not oppose the responsible use of these technologies.
Yeah, and I think clinicians really need to take a role in that, right? Because we're the ones that serve our patients, really.
Right, because if we stand to the side, there is a 50-50 chance that things will just magically fall into place,
Right.
or we will increase cost, we will increase bias, we will increase disparity, and we will just have missed the opportunity to engage effectively. So, given the interest and given the passion, there are some folks who maybe have more of a proclivity for this kind of an endeavor. But at the very least, I think having the support of everybody here at HRS and our society being so close-knit and wanting to engage effectively in generative AI has been really encouraging. So we're excited to see what comes next.
Yeah, this sounds super promising, and I know there's definitely more to come, and I'm excited to sort of hear about the phase 1 results. Hopefully it'll come down the pike pretty soon, right? So I know you can't give it all away, although I would love for you to do that. I will not ask you to do that. So thanks again for taking the time to sit with me today, my friend. And I see a very bright future in this for you and for the organization. So thanks again.
Thank you so much, and I'm so grateful for the tribe, for the village. It really does take a village, and we're hoping and trying our best to do this responsibly. And as things come off the press at HRX Innovation Hub and Heart Rhythm TV, we'll be sure to share the news.
Wonderful. Okay, so this is Janet Han and Mehak Dhande here from HRX 2024. Thanks for listening.